What's going on, everyone? Happy Monday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, a flu test, RSV, maybe some other virus, I hope you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Monday edition of the Virus Update for Monday, December 9th, 2024. If you're new to my channel, welcome to my channel. You clicked onto the channel where I do updates on all those viruses that can make us sick. Let's face it, there's a lot of viruses out there, and to this day we still learn about new viruses. You know, these viruses can be dangerous to our health. You need to be informed with what's going on with these viruses. That's what I do here on my channel. Want to stay informed? Subscribe down below. If you like this video, give it a thumbs up. The more people that give this a thumbs up, or even just leave a comment down below, it helps me in the algorithm, and it helps YouTube say, hey, you know what, people really like that content. Let's push it out to more people. And that's what happens. And of course, you can share this with anyone you know, and hit that notification bell to be notified of my latest updates. Alright, today is going to be probably about a 13 to 15 minute video. We're not looking at one of those 30-minute videos today. We do have a few news stories to report on. We do have an update on the Congo mysterious virus. We have some new data from Walgreens. We're going to take a look at some wastewater data. And we're going to look at the wastewater dashboard for COVID for a city we have not looked at in a very long time. Yes, now it hasn't updated for December, but it does show the end of November, and I think it is due time that we take a look at that dashboard. Starting off today in California, Marin County, California, health officials are investigating a suspected case of H5N1 bird flu in a child. The source of the infection is unknown. If confirmed, this would be the second case in California in a child. Not good. This is something we're obviously going to have to keep an eye on. We do know what happened with that case up in Canada. Of course, we knew what happened, say, a few weeks ago. We have not had an update on that case, but last we heard, the one up in Canada, the child was in critical condition, which is not good news whatsoever. And of course, now we're starting to see potential cases in kids in California. Yeah, that is not a good thing whatsoever. Moving on to this now, the update from Congo. The WHO has released a detailed update about the unidentified illness in Congo. Here's a quick summary from BNO News. We're not going to read the whole thing. We're going to just read some of this. Cases and deaths. This was as of, I believe, yesterday evening. I didn't see anything new this afternoon. Of course, if something new pops up, that will make it on the next update, which I believe is going to be on Wednesday for us. Next virus update that I do. Cases and deaths. 406 suspected cases, 75 deaths, 31 at healthcare centers, and 44 at home. Demographics. The majority of cases involve children. That's not good. We just talked about children with H5N1, and now we're talking about another potential virus. And it looks like all severe cases, which the majority involve children, were severely malnourished. So that's not good. It says timeline. First case was on October 24th. Cases appear to have peaked in early November, but the outbreak is still ongoing. And it does say here acute pneumonia, respiratory tract infection, influenza, COVID-19, measles, and a whole bunch of other things are potential causes. It's possible that more than one disease is involved. Cases have been reported in family clusters, suggesting potential transmission within households. So, yeah, this is getting concerning. Of course, there's a whole lot more here. We're talking about food insecurity, poor health care, access. This is happening in a very remote area. I've heard several sources talk about that. So getting any testing done and any of that business, you know, to get answers, it's going to take time. This is not something like, oh, well, let's just find out what's happening real quickly. Not going to be the case, because this is a very tough area to access to, it sounds like. And it says the risk level is high for affected communities. The national level, moderate risk due to the potential for spread coupled with gaps in surveillance, and regional and global levels. Low risk, though the proximity to Angola raises concern about potential cross-border transmission. That's not good. So that is the latest on the illness, mysterious virus in Congo. Hopefully we will start getting some answers soon, but I just got a feeling this is going to be one that takes some time. We'll just have to wait and see how this one actually ends up playing out. There is a thread over on my site, datareport.info, where we are, going to be discussing this and talking about, not just me, but other people as well. There are other members on my site besides me. You can sign up to become a member for free. It will always be free, and you can add in your input if you want to, or if you find something and you want to share it in there, go right ahead, and you can post anywhere on my site. All right, moving back to the United States, Minnesota reports highest level of whooping cough cases in more than a decade. Yeah, this is something that's not good. Whooping cough cases are on the rise across the country. I've been talking about this time and time again. And right now, Minnesota is not doing well. Minnesota is reporting the highest number of whooping cough cases in more than a decade, the state Department of Health says. As of last Wednesday, 2,324 cases of whooping cough, also called pertussis, were reported by healthcare facilities, medical labs, and schools and child care centers, with the majority in the Twin Cities metro. That's the highest number of reported at this time of year since 2012, where, wow, 2012 they had 4,144 cases. Yeah, that's a high number, so good thing it's not that high, but 2,324, that is really a high number, and obviously I think this, who could have expected it? That's probably what they would say, but it's to be expected. It's rising all around the country. We started seeing it rise in the UK first, and now it's rising here in the United States. It's an ongoing problem. Let's talk about something else that's an ongoing problem. Long COVID. I took a poll yesterday. This was one of the bigger polls in terms of number of votes compared to my previous polls that I'd done recently. And I put, do you know someone who is dealing with health issues post-COVID? This can be long COVID itself, or something they won't say is long COVID, but started post-COVID infection. First off, yes got 93.5% of the vote. No got 6.5%. That is out of 508 votes. And you know what? There's more votes to come in. Let's do a little bit of a repost there. See if more people vote. Well, only 1 hour left. But 508 votes and 93.5% said yes. That's concerning. A lot of people know someone with long COVID at this point in time. Some people are dealing with themselves and probably put yes. So yes, it is relatively concerning how many know someone who's having a post-COVID health issue. Something else that is an issue today is the air quality. In many parts of the country, there are ongoing air quality issues. In the east, we had a warm front move through in the northeast, and there's still some lingering moisture in the air. Sometimes that triggers these sensors to be higher. You can see the Great Lakes in the southeast. And then the west coast, it is fireplace season, so that is a problem as well. Want to learn more about the climate and weather? You can do that on my other channel, Climate Data Report. As soon as I'm done with this video, I am going to do a quick video over there today. Not my longer 15 to 18 minute video. Well, at least I don't think so. But I'm going to do a quick video on potential for severe weather in the east over the next several days. And Wednesday is really starting to catch my eye. There could be a significant wind threat with the heavy rain that comes through in the east on Wednesday. See that channel for details. There will be a video coming there very shortly. That is Climate Data Report. Taking a look at the latest from Philadelphia in terms of EMS calls. Looks like Sunday had 806, and let's see, Saturday had 758 EMS calls. Now, before we go on and take a look at what's going on in the outside counties of Philadelphia, we did get an update today. Yes, and that update is on Philadelphia's dashboard for COVID. It did finally update, and it looks like hospital admissions were very low. I'm seeing only, as of the 1st of December, just 2 admissions. I don't know how accurate that is, because I have heard several instances of people going to the hospital in my city, and I've had neighbors go to the hospital over the past several months. None of them were tested for COVID upon admission, which, I don't know. Are they actually testing everyone for COVID? I really do not know. Taking a look here at what's going on with deaths, there were a few deaths back in September. Not seeing anything after that. And wastewater in Philadelphia. We can see here that the northeast section of the city, while it was dropping, most recent update went up a little bit at the end of November. Southeast Philadelphia, that is dropping, and it looks like the Southwest Water Treatment Facility had a little bit of a rise at the end of November. No surprise there. Taking a look at what's going on in Montgomery County, Pennsylvania, we do see vehicle accident listed several times. That's not a good thing. Sickable episode, respiratory emergency is listed 1, 2, 3 times, and well, there's why vehicle accident is showing up on EMS. Total 14 accidents. What? That's ridiculous. You have to wonder, critical thinking is something that gets harder with COVID. If you've had COVID, it does mess with the brain. I don't know. Just speculation there on that one. But taking a look at Chester County, Pennsylvania, and we can see here just a few calls right now. Respiratory emergency, unresponsive person, that's never good. Hypotension, abdominal pain, falls. Yeah, a few things going on there right now. And taking a look at what's going on with the hospital situation in Pennsylvania. And let's see here. Oh my. Yeah, the refresh did not look too good. Lehigh Valley, yet again, a ton of yellow hospitals. Some of that could be emergency departments. Some of that could be behavioral health. Yet again, Westchester is overcrowding. I mean, is that hospital, is there ever a week that goes by since we started looking at this where they are not having problems? Malvern, Pennsylvania, look at this. Emergency department overcrowding. Warren, New Jersey, emergency department overcrowding. Yeah, it's just not, wow. Look at this one. St. Luke's, Geisinger Hospital, emergency department overcrowding, emergency department nearing capacity. That is not good. Let's move on because it's just all bad news there. But you can see here, even Western Pennsylvania, a lot of the hospitals do not update. The ones that do are in the green. That is some good news. In Canada, the viral activity level for COVID-19 is moderate. Flu A is low. Flu B, not detected. RSV at this time in Canada is running high, so that is concerning. All right, drum roll, please. It is time for the new update from Walgreens. And here you go. No surprise, things are trending in the wrong direction for COVID. But more people got tested. Total tests, 5,200. That is an increase. It's a bigger increase than we saw for Thanksgiving. It didn't go up for Thanksgiving. 3,696 was reported the previous week. And the COVID positivity rate, 15.2%. That is up by 1.9%. Prior week was 13.3%. Let's start off on a positive note. Maine, your positivity rate, well, because I said positive note because it's coming up green. Quick reminder, green on the map means positivity rate dropping. Orange and red means positivity rate rising. And the majority of these white states just are not updating. Let's try again for a positive note. Oh, here we go. Massachusetts. And, I mean, why am I even clicking on this? 33.3% current week. Prior week was 66.7%. Just 3 COVID tests done at Walgreens, Massachusetts. Just 3. Mind you, they have the city of Boston. They have Springfield, Worcester. I mean, it's a populated state. Just 3 tests. Come on, that's ridiculous. Taking a look at New York State now. And in New York State, we see the positivity rate is 22.8%. Prior week, 15.9%. That's a difference of up 6.9%. Total test, 193 versus 132. Yeah, your positivity rate's going up. Texas, 11.1% this week, 9% the previous week. Difference of up 2.1%. Total test, 971 versus 641. Yeah, that is definitely going upward, and your testing went up by a good amount. California, 13.6%. Big increase here. That is up by 5.1% from 8.6% last week. And testing went up, so you are definitely rising now. 191 total tests versus 152. Alabama, 19.2% positivity rate. That is up by 6.3. That is up from 6.3%, and that is a 12.9% increase. So yeah, really big increase there. Missouri, 19.6% positivity rate. The prior week was 12.8%. Difference of up 6.8%. Total test, 107 versus 86. Michigan is reporting a positivity rate of 23.4% versus 16.9%. That is up by 6.5%. Total test, 124 versus 89. And in the state of Washington, 9.1% positivity rate. the prior week was 12.5%. You're actually down by 3.4%. Total test, 66 versus 48. And some might say, boy, that's a surprise. It can be, but it also cannot be. Washington got hit really, really hard with COVID in the summertime. So, I mean, it's going to probably take a stronger variant for Washington to really start going up. But I believe at some point they probably will even have a rise there. Maybe not a big one, but a rise there in the coming near future. Now let's quickly take a look at some wastewater scan data. And I want to show you a couple of things here. First off, here's nationwide, and we can see overall, COVID is starting to see a slow rise. There's this wonky drop at the end. Pay no attention to that. You're going to see a lot of wonkiness, which is why I think I'm going to limit how much I show you from wastewater scan. The first part of the week often has these wonky movements that then get corrected later in the week. RSV is overall rising, as is influenza A, influenza B, though very low for influenza B, HMPV very low, and norovirus has been rising. And now taking a look at the Northeast, again, viewer expression advised. This is going to really look much worse than it actually is when you see, see, there's one of them wonky movements. COVID is not rising that fast in the Northeast. It may be going up, but that wonky movement is incorrect. I hope it will get corrected later in the week. And it is showing that COVID is listed high, but again, with that wonky movement, obviously, that took it right up to high levels. RSV is listed as high, and this is multiple updates. RSV has been really rising in the Northeast. I am concerned about that. Influenza A is still low, but it is overall going up. Influenza B is low. HMPV is low. Norovirus has been rising for multiple updates, although the last one being a wonky movement still. Even without that, it would have been really high levels for norovirus. And now let's take a look at the Midwest. We might as well just do all the regions while we're at it. Taking a look at the Midwest, rising slightly, medium COVID levels. RSV, it's listed at low, but I'll tell you what, it's quickly moving up here, although a wonky movement at the end. Influenza A at this time is still low. Influenza B is low. HMPV is low. And norovirus is listed high, but a wonky movement at the end took it downward. We'll see how that gets corrected later in the week. Down in the south, we can see here, COVID levels are medium at this time. They're just rising ever so slightly. RSV has been rising. Influenza A is rising at this time. Influenza B is low. HMPV is low. And norovirus is rising at this time. On the West Coast, taking a look at this, we can see here COVID levels. They're low, but they're rising slightly. RSV is rising. Influenza A is high and still rising. Influenza B is low. HMPV is low. Norovirus is high at this time. Alrighty, time for our dashboard we have not looked at in a long time. Just going to take a brief look at Houston, Texas. And we can see here, as of November 25th, there were a lot of these dashes, which means not going up, not going down. That means pretty much holding steady. But at the same time, you do see a couple places dropping. You do see on the southeast side of Houston, Texas, it looked as if there were some wastewater sites that are starting to trend upward, which is not a good thing to see. And if I had to guess, post-Thanksgiving, or since this has last updated, there's probably a few more that are starting to rise at this point. Alright, moving on now, taking a look at New Jersey. There are multiple hospitals in New Jersey. Mullica Hill is having patient volume problems. Capitol Health Regional Medical Center also having patient volume problems. There are hospitals in New Jersey today having some issues. The majority are not, but there are a few that are starting to run into some issues because the hospitals are getting busy. In New York State, 584 new cases added on the new update, and you can see the overall trend on this chart now is starting to trend upward a little bit. And hospitalizations, they were down on the most recent update. In the hospital, as of 12/6/2024, 426 people and 43 people in the ICU. I would be surprised if we do not see a rise again tomorrow. But we'll have to wait and see what tomorrow brings. Alrighty, folks, that does it for the Monday edition of the Virus Update. The next update is going to be on Wednesday, but I will have a post on X if that does change. If you enjoyed this update, give it a thumbs up. If you want to see more like this, just subscribe down below. hit that notification bell to be notified of my latest videos, share this video with anyone you know, and leave your comments down below. I will see you all again next time. Until I see you again next time, stay safe everyone, have a fantastic Monday evening, and thanks for watching.